Thorough preparation is the first step before applying. Hand sanitization is mandatory before any contact with the client's skin. The next stage is applying the oil to the target area. Usually 3 full pumps of oil are enough for the entire back. This volume is sufficient for the entire back and the client's arms. Gently glide your hands from the lower back up to the shoulders and arms. At this stage, I'm just spreading the oil along the primary glide lines. Then apply more palm pressure to warm the tissues and increase contact. Ensure even oil distribution, leaving no dry areas. Returning to the glutes, spread the oil using broad fan-like motions. Gently move to the neck area to prepare this zone. Repeat the oil application on the client's arms. Perform a general gliding stroke along the entire back and arms should be covered in a thin, even layer of oil. This application should feel smooth and continuous to the client. Avoid patchy application. Don't add oil in small separate drops. Broad application immediately creates a sense of comfort and care. This turns preparation into a seamless part of the session. The application flows naturally into full-body warming strokes. Next, warm the superficial muscles before deep tissue work. Our first active technique is intensive friction. Use your palms for friction, focusing the effort on your forefingers. Place your hands and begin short, energetic friction strokes. Start with short passes, you can lengthen them later. Work methodically along the spine, following the erector muscles. At the upper back and traps, switch to a diagonal hand position. The client's head limits your range here, so adjust your angle. Straight strokes only warm the back up to the shoulder blades. To fully reach the upper traps and neck, move your hands slightly outward. After reaching the top, smoothly glide your hands back down. Finish the friction and immediately follow with a soothing full back stroke. That first step warms the skin for the work ahead. The next warming technique targets deeper layers. We're heating the fascia and superficial muscle layers. This technique uses soft, relaxed fists. Starting at the sacrum, use your knuckles for short friction strokes. Note that all movement comes from your core and body weight. Avoid using only arm strength to prevent early fatigue. Gradually work your way up to the top of the back. On the upper traps, use straight warming glides. You can also add circular friction around the C7 vertebra. Then return to the low back with a smooth, straight glide. Repeat 2 or 3 full cycles for thorough warming. Always follow each cycle with a general soothing stroke. The stroke should cover the entire oiled area of the back and arms. General warming is complete. Now we begin detailed work on specific zones. First, we'll focus on the upper glutes and the sacrum. Next is deep work on the lumbar and lower thoracic regions. Then we move to the upper thoracic area and between the shoulder blades. After the scapulae and arms, we'll work the traps, C7 neck and head. We finish with the client supine, working the chest and anterior neck. Let's focus on the sacrum, which is now warmed and ready. We begin deep work using thumbs for pinpoint pressure. This technique allows me to feel every muscle fiber under my thumb pads. My goal is twofold: deep massage and identifying hidden tension. Short thumb glides help me locate all trigger points. On the triangular sacrum, we first follow a straight vertical line. Work the attachment points where the erector muscles anchor. This effectively releases tension at the base of the spine. This effectively reaches all deep erector spasms. Notice my thumbs stay still against the skin. The movement comes from my body. After 2 or 3 passes, perform final straight glides down the center. Respect the boundaries. Never apply deep thumb pressure. Deep pressure on the spinous processes is strictly forbidden. After working the sacrum, finish with local soothing strokes. Now let's focus on one side of the sacral area. Work the areas missed during the straight vertical passes. At the corner of the sacrum, we find the gluteus maximus attachments. Deep thumb pressure is very effective in this area. Now we need to work the soft part of the glutes to release blocks. I use the stacking technique for a lighter, more pleasant release. Place 4 fingers on the sacrum, cover them with your other palm, and use spiral glides. Move from the center outward and back in a circular motion. The bottom hand controls the path of these spiral movements. The top hand provides the necessary downward pressure and depth. After the palm work, return to pinpoint thumb work. I've just found a line with a clear, deep muscle blockage. Broad palm pressure missed it, but the thumbs found it. This point will be sensitive for your client, but working it is necessary. Think of your fingers as high-sensitivity tools for finding triggers. Once found, work the trigger with one finger using deep, sustained pressure. If one finger isn't enough, use the reinforced finger technique. Press with 2 fingers together and wait for the knot to release. This deep pressure technique is called ischemic compression or acupressure. Some call it shiatsu, but it's essentially classic trigger point therapy. Pin the muscle against the bone and wait for the biological response. As the fibers release, your finger will naturally sink deeper into the tissue. You will clearly feel this moment of release. The muscle is releasing now, and my fingers are shifting deeper into the spasm. I've shown the 1 or 2 finger method for finding blocks. If the glutes are too dense for finger pressure alone, try this. Place your thumb on the point and press down with the heel of your other hand. This lever technique allows for maximum depth with minimal effort. It's easy to perform, but powerful enough to release chronic blocks. The thumb provides a small surface area for deep penetration. The force comes from the weight of your top hand pressing down. What is the main trait of these deep muscle spasms? People often live with these issues for years, not just days. In my practice, I often find chronic spasms that took decades to form. Causes vary: sedentary lifestyle, gait issues, or old injuries. The longer the tension has existed, the more effort is needed to release it. If a spasm is only a few months old, it corrects fairly quickly. However, chronic tension cannot be fully released in a single session. Be honest with your client. Instant healing in chronic cases is unrealistic. Still, even one deep tissue session will provide significant pain relief. After pinpoint work, follow up with deep stripping along the entire muscle. I can feel the tension running along the full length of this muscle. Now I'll perform a deep glide using a specific hand position. Stretch your hand wide, creating a firm line between your thumb and index finger. In this position, you can lean your body weight in without straining your palm. Perform a deep glide where your entire arm acts as the tool. Simply transfer your body weight into your lead arm and lock it. The arm stays still relative to your torso. The movement comes only from your legs. This mechanic ensures the highest quality deep. Next, glides using 2 thumbs pointing upward. Rotate your hands so the backs face each other and repeat the deep glides. Using both hands together is much more effective and less tiring. Perform all deep glides slowly and smoothly to minimize client discomfort. Jerky or fast movements will only increase pain and trigger muscle guarding. Another deep tissue option is forearm stripping. Once you find the tension, use your forearm first. Don't use the elbow yet. Anchor your forearm and lean your full body weight into it. After the deep compression, perform a slow targeted glide along the muscle fibers. The muscle fibers in this area run in this longitudinal direction. Always perform deep glides along the fibers, never across them. If fingers or forearms aren't enough for a specific trigger point, use your elbow. The gluteal zone has enough muscle mass to make this technique safe. Apply pressure gradually to the trigger point. Hold the compression at its deepest point for a few moments. With experience, you'll be able to land your elbow precisely and safely. For beginners, the elbow may slip, so use your other hand for support. Locate the spasm and create a V-grip with your free hand. Your palm will now secure your working elbow, preventing it from sliding. Bracing the elbow against your fingers ensures a safe and steady stroke. As the fibers release, your elbow will naturally sink deeper into the tissue. After intense pinpoint work, always finish with general kneading. Use circular motions to flush the area with fresh blood. Add rhythmic tapotement, cupping to fully relax the worked muscles. Tapping relieves residual tension and boosts circulation. Finish this side with broad, soothing strokes. Smooth over the back and arms so the warmed muscles don't cool down. Maintaining tissue temperature is key to the therapeutic effect. Now smoothly transition to the other gluteal side. Repeat the entire sequence on the other half of the sacral triangle. Start with detailed work using short thumb glides. After thumb compressions, move to long, deep, straight glides. If you need more power, stack your palm over your thumb. This achieves depth without overstraining your wrists. Rule: never use your elbow on the bony parts of the sacrum. Also avoid using the ulna bone directly on the client's sacrum. Use only soft parts, thumb pads, palms, or soft fists. Avoid elbows in the central sacral area to prevent injury. Continue relaxing the glutes using stacked hands. Perform smooth circular or spiral motions. You can also stack your palms for broad glides from the center outward. Choose the hand position that best fits your ergonomics. Reinforcing the distal hand with the proximal one is often very effective. The reverse works too. Anchor the proximal hand and press with the distal. All circular rotations should be directed away from your body. Direct the force into the inner palm. Avoid awkward wrist twisting. The glute is ready. Now we begin detailed thumb work. I can feel I feel the spasmed fiber right here, creating a blockage. I have enough strength to work this with a deep single thumb compression. For more power, stack one thumb on the other for a slow, controlled release. After the glutes and sacrum, always finish with a soothing stroke. Now we're ready for the lumbar, thoracic, and lateral back massage. Note, working the upper glutes is mandatory in a back massage. If glute tension remains, the entire back massage will be less effective. Tight glutes and impinged nerves here will inevitably cause low back pain. Working only on the lumbar region provides only short-term results. A quality back massage must include deep sacral and gluteal work. We return to general strokes to integrate all areas. I always add a medium deep compression to the strokes for tone. Start at C7 with soft fists and glide down to the sacrum. Enter the sacral area gently. Use only the soft part of the fist to avoid the bone. Follow the erectors and transition back to a broad, smooth stroke. Slide your hands up and move to the side of the table. Now we begin detailed work on the lateral back. The focus is on the lumbar region and lower thoracic segment. We will also engage the upper thoracic scapula and shoulder. The first technique is straight stripping using 4 fingers. Place hands on the opposite erectors and perform a confident glide. Move upward as long as you can effectively lean your weight into it. If your hand drops too low, the pressure comes only from arm strength. Avoid this. Avoid the abdomen. Focus on alternating glides on the lumbar zone. Do 5 to 10 slow, smooth glides sinking into the tissue before each move. Next, move forward toward the client's rib cage. Perform glides with one hand following the anatomical curve of the ribs. Use the hand closer to the head for a better fit along the rib line. Next, deeper work on the erectors along the spinal column. Apply pressure to intercostal spaces while the other hand performs straight glides. Repeat 5 to 10 times, securely anchoring and compressing the tissue. Maintain a firm grip and apply targeted pressure. The lead hand does the main glide, the second hand works more softly. This is vital because the second hand crosses the ribs at an angle. Heavy cross-rib pressure is painful and ineffective for relaxation. After 5 to 10 reps, move to the scapula and upper trapezius. Here, muscles fan out from the shoulder joint. One hand glides down the trap to the shoulder, the other starts at the scapula. Move from the spine toward the scapula, repeating 5 to 10 times. Now place your hands and perform a smooth downward stroke. Power the stroke with your core and legs, not just your arm strength. Shift your weight from leg to leg, leaning back to increase traction. Next, return to the paraspinal muscles and anchor your fingers. Perform circular palm rotations working through the same zones. Do 3 to 5 rotations in the lumbar area, then move to the lower thoracic. Perform up to 5 repetitions on each local segment. Goal: compress the upper muscle layers and create a circular shift. This creates a very smooth and gentle stretch of the fibers. Move between the scapulae, work the shoulder blade, and knead the shoulder. Then perform a similar shifting movement downward. If using both hands is difficult, try this alternative. Stack your hands, apply firm pressure, and perform reinforced circular rotations. The third lateral technique specifically targets the erector spinae. Sinking near the spine, perform a short circular outward shift. After 2 to 3 reps, move to a new section and continue. Repeat 3 to 5 times at each new location. This is similar to the compression shift technique used earlier. Sinking into the tissue, shift the erectors away from the midline. The lateral shift should be about 4 to 5 millimeters. Stretch the muscle, perform a circular move, and repeat. Important: avoid sliding on the skin to keep the stretch effective. Sliding means you haven't anchored the muscle or created enough tension. Anchor the tissue and perform a short, clear outward shift. The movement should be short and elliptical. Stop at the upper scapula where movement becomes awkward. Glide to the shoulder and smooth out now for a second version. Use the heel of your palm, anchor it, and perform a short, sharp glide. Stack your other hand on top for pressure, ensuring there is no sliding. Finish the cycle with a general stroke from the center of the table. From here, it's easy to smooth over the entire back surface. You can also perform targeted strokes on the lateral zones. Use broad wrapping strokes along the sides of the torso. Place both hands mid-back and move outward, hugging the sides. Glide, return, move forward slightly, and repeat. Work upward toward the thoracic area, continuing the lateral strokes. At the shoulders, transition to the arms, then back to the lumbar zone. Pivot your body while maintaining contact with the client. Now at the head of the table, perform another deep, soothing stroke. Place your hands symmetrically on both sides of the back. Now repeat the sequence on the opposite side, starting with straight glides. Notice how I use my body weight, constantly moving my feet. The power comes from smooth weight transfer, not arm muscles. My hands are locked, the drive comes from my legs. We've now finished lateral work on both sides. We will work on one side at a time. Start with straight palm glides over the erector muscles. First glide upward, second use reinforced stacked hands. Apply deep pressure reinforce. Use the full palm surface, applying pressure as evenly as possible. First pass along the midline, then shift slightly outward. Direct your effort toward the outer line, working the latissimus dorsi. Work up to the shoulder and return with a soothing stroke. Always remember to use your body weight. As you move up, watch the edge of the scapula to avoid a collision. Don't let your hand slide under the shoulder blade yet. At the scapula, pivot your palm upward and smoothly bypass the bone. Moving to the next stage of back work. For a larger back or thick erectors, use soft fists. Start the glide from the sacrum near the iliac crest. The erectors begin here. Remember to avoid the spinous processes. Place your fist and glide up as far as your stance allows. Overreaching loses balance and reduces efficiency. Stay planted during deep glides to avoid jerky movements. Any jerks with the fist will be very unpleasant for the client. Maintain a stable position and glide to your most comfortable reach point. Then return and use the second hand for a similar pass. I prefer one fist in this position and the second slightly offset. This fits the anatomy perfectly. All techniques should be performed from a comfortable stance. Awkward wrist angles will eventually damage your own joints. Secondly, it results in poor quality for your client. Remember therapist ergonomics directly. Following this rule ensures both safety and effectiveness. Repeat 5 to 10 of these alternating glides. The erectors are now softer and ready for even deeper work. Maximum depth is achieved using the thumbs. In this case, I use a reinforced technique instead of alternating glides. I place my thumb, stack the other palm on top, and perform a deep glide. Glide only as far as you can maintain full control over the pressure. Avoid overreaching or stepping during deep pressure, it reduces efficiency. At the limit of your comfortable reach, transition to a stroke and move down. Repeat 5 to 8 times, feeling for any deep-seated tension with your thumb. I can clearly feel that the lumbar muscles are the tightest here. This specific segment is in a state of severe hypertonicity. There are no major spasms further up, but the lumbar area remains very tight. We'll apply extra focus here to effectively release this deep tension. Both the erectors and deeper layers may be tight here. The visible muscle contour shows they aren't relaxing even while lying down. Next, let's target the quadratus lumborum QL, connecting the ribs to the pelvis. I move slightly lateral to the erectors and apply deep thumb pressure to palpate. The client's reaction and the tactile feel confirm the tissue is very dense. Ideally, the muscle should be palpable without such painful hardness. Under pressure, I can feel my thumb being blocked by the muscle's rigidity. In healthy tissue, I could sink much deeper without such resistance. The client would feel depth, but not the sharp pain caused by a spasm. To compare, both the erectors and the QL are in hypertonus here. This muscle attaches in this region will give it extra attention. In this area, I use alternating thumb pad compressions. You can also use both thumbs simultaneously for more powerful pressure. Now gradually shift your focus toward the periphery. The pressure here should be more delicate than in the central lumbar area. The central muscles are thick, allowing for intense deep work. The peripheral muscles are thinner, so work with less force. Goal stretching the fibers, I start at the attachment and move toward the ribs. I mix in soothing strokes to ease any discomfort during deep work. To reduce pain, you can also work downward, from the ribs to the pelvis. We move toward the attachment points on the pelvis where congestion is highest. Spasms occur most frequently at these muscle attachment sites. I anchor my thumb at an attachment point and pause to release the spasm. You can also add deep glides from the spine outward toward the side. Perform all movements in this area smoothly, strictly avoid jerky motions. Notice I don't touch the ribs, working only in the soft muscle zone. Work only the muscle segments not covered by the rib cage. My thumb pad is now right above the iliac crest. I apply firm, deep pressure here, using the underlying bone as a base. Finish this step with a series of smooth glides to calm the area. For this session, this side of the lumbar region is now sufficiently worked. After deep tissue work on the erectors, we add a final touch. Perform a broad upward glide along the full length of the erectors. Now smoothly move to the opposite side of the table. Once in position, repeat the same techniques on the other side. Maintain contact. Keep one hand on the client's back as you move. Glide upward, then use both hands for a unifying full back stroke. Return to the low back and settle into your working position at the side. Ready for the next cycle, starting with straight palm glides. I work the proximal side, applying deep pressure to the erector muscles. I use the full palm to glide along the spine up to the shoulder joint. Apply medium intensity here to prepare the tissue. Maximum force isn't needed, yet this is a preparatory glide. Next, we move on to gliding using soft, relaxed fists. This versatile movement allows you to vary the depth according to your goals. Use it gently for relaxation or with high intensity for deep tissue work. The ergonomics of your fists allow you to maximize your body weight. This enables deep pressure without straining your wrists. Just shift your weight. Another option if the muscle remains tight after fist work. For severe tension, I apply extra work before moving to thumb techniques. Use your forearm for more powerful and uniform pressure. Place the forearm directly on the problem area or at the start of the muscle. I can clearly feel the tension line, for example, in the lower thoracic area. Forearm work is especially effective for hypertonus. Let's start at the lumbar. Place your forearm strictly on the erectors, avoiding the side of the body. Use only the fleshy part, avoid pressure on the spinous processes. Concentrate all effort strictly on the muscle bands along the spine. Maintain steady body weight and begin a smooth, deep upward glide. Lead the arm until the elbow reaches the edge of the scapula. Finish the compression there and perform a smooth stroke back down. Repeat the deep forearm compression once more. For local work, start the movement directly from the lower rib line. Hypertonicity is often visible in the lower thoracic area. When tension is found, anchor your forearm and apply controlled pressure. If you lack body mass, use the reinforcement technique. Stack your second hand on top of the working one to significantly increase pressure. Pressing on the working hand provides better depth and control. This achieves a highly effective release of the spasmed area. Additionally, use your forearm as a lever by adding rotations. With the forearm anchored, move your arm in a circle to create powerful leverage. The arm moves in a circular path instead of linear, ensuring deeper work. This semicircular weight transfer is much more effective on tight tissue. Always follow a heavy technique with a soothing stroke to calm the area. After this preparation, the muscles are ready for detailed thumb work. Place your thumb on the lumbar, reinforce it, and perform a deep glide. Warming with fists and forearms allows the thumb to penetrate very deep. Glide as far as you can while maintaining full control over the pressure. Repeat 5 to 8 times at a calm pace, returning with a light stroke. Work slowly and mindfully, as we are engaging significant muscle depth. Perform a local stroke on the working side, then a unifying full back glide. Maintaining contact, smoothly move to the head of the table. From the head, perform final soothing strokes over the entire back. Next, detailed work on the upper thoracic area and between the scapulae. Even if already warm, this specific area requires extra attention. After a general stroke, return to the head of the table to repeat the smoothing motions. From here, perform long, deep compressions with soft fists, moving both up and down. You can also use both fists simultaneously on either side of the spine. Power all movements with your body weight, balancing smoothly on your feet. Slightly rotate your fists for a more comfortable and secure compression. Without this rotation, your hands may slide outward. Use the full surface of the fist for maximum client comfort. This feels softer and more pleasant, yet remains deep and effective. Now that the interscapular erectors are warmed, we're ready to proceed. Start detailed work using alternating thumb glides. Note the specific anatomy here for proper technique. So far, we've worked longitudinally along the paraspinal muscles. These are the long erectors which run straight up the back. The erectors span the entire thoracic region and attach at the base of the skull. That was the first group. The second group runs laterally. These fibers attach at the spine and run toward the inner edge of the scapula. This is the most common area for deep muscle tension. Spasms here affect either the erectors or the muscles near the rib angles. The rhomboids in this area are very frequently tight. This includes the rhomboid major and minor with the serratus lying underneath. They share similar anatomical positions, so follow this sequence. First glide along the spine, then move from the spine toward the shoulder blade. Begin by alternating strokes along the spinal column to work the erectors. Use moderate pressure to avoid fatiguing your thumbs. Palpate deeply for any knots or tension points along the spine. Work upward to the trapezius while maintaining a comfortable stance. Return to the starting point, then shift slightly lateral. Now work the erector attachments near the rib angles. You'll often find that the attachment points hold the most tension. Watch the edge of the trapezius, you can see it shifting under the skin. Avoid gliding directly over the edge or the muscle will snap aside. This snapping causes pain and prevents muscle release. A common error is gliding where the muscle pops out from under your finger. This irritates the tissue and increases hypertonicity. Remember, the traps run diagonally toward the spinal column. If the muscle is very tight, work strictly along the direction of its fibers. Following the fiber line prevents snapping and allows for deep compression. This technique is vital for targeting specific segments of the trapezius. Use this when you need to focus on a particular muscle area. Avoid the edge shift slightly inward where the muscle is more stable. The edge of the trap is often thick with tendon, the center is softer. Working the softer center allows for deep, painless glides. Follow the fiber direction here to access the deeper layers effectively. To increase pressure on deep erectors, use the reinforced thumb technique. Place your thumb at the upper scapula and stack your other palm on top. Use the heel of your palm for leverage and perform a slow, controlled downward glide. Glide strictly along the spine for maximum quality and depth. This engages all layers of the muscle frame. After 5 to 6 deep glides, always finish with a soothing stroke. Now move to the other side for symmetry. Start from where we finished, working the lower thoracic region. Use the start of the thoracic kyphosis as your landmark. Perform alternating compressions while palpating for trigger points. There is clear hypertonicity here. The scapular muscles are quite dense. To reach deep layers, you must first relax the superficial tissue. Visually, the muscle tone on this scapula is much higher than the other. The larger volume suggests this arm is used more and carries more stress. This hypertonus is visible even while the client is resting. Note the elevated shoulder, a sign of constant postural tension. We must work this area with extra care and depth. Start the detailed massage with deep, firm compressions. Place your thumb, reinforce it with your palm, and glide slowly downward. Be careful not to slip over the edge of the trapezius during the glide. Stop exactly at the muscle's boundary. Apply deep pressure, but halt smoothly once you reach the boundary of the trapezius. You can glide further, but release the pressure to prevent the muscle from painfully snapping. After the first paraspinal line, shift 1 centimeter toward the scapula. Now compress the next section between the spine and the shoulder blade. Forearm work is also an option to efficiently knead dense muscle volume. Place your forearm on the inner scapular. This is effective if the scapula isn't too elevated, allowing full contact. In this position, you can apply deep pressure if it doesn't cause excessive pain. However, this technique requires a keen feel for the body and anatomy. For most, a longitudinal forearm position is safer and more effective. Positioned along the spine, you won't hit the spinous processes or the scapula. Anchor on the muscle belly and perform deep, controlled glides. Mind the trap's edge. Crossing it too abruptly causes a painful snap. Avoid these mistakes by controlling every inch of the forearm's movement. You can also pause in one spot to apply sustained deep pressure. Shift downward slowly, gradually relaxing the target area of the back. Remember, as you reach the trapezius, reduce the pressure in time. Finish the deep work, slowly release, and follow with a soothing stroke. Regarding elbow work, I rarely use deep pinpoint elbow pressure in this zone. In practice, using an elbow between the shoulder blades is often ineffective. It's hard to hit a trigger point with an elbow, but very easy to hit a rib. This won't release tension, but will cause significant pain. I don't recommend it. Gently smooth the area after the preparatory. The muscle will shift under the elbow, creating an unpleasant sensation. Use your forearm for power, but avoid pinpoint elbow strikes in this area. Now that the tissue is softer, use your fingers to release residual spasms. Pain points are often found where the erectors attach to the ribs. If more power is needed, use the reinforced thumb technique. Anchor on the trigger point, apply deep pressure, and wait for the release. Alternatively, place your thumb and reinforce it with the heel of your other hand. Lean your full body weight through a straight arm instead of using hand strength. Release slowly and knead the area to restore blood flow to the point. The muscle fibers should now feel much more elastic. This proves the effectiveness of this approach for deep trigger zones. Compress and hold, allow time for the tissue's biological response. A smooth, soft release finishes the work on that specific knot. This comprehensive approach fully addresses the inner scapular area. With major blocks, remove the muscles are ready for the final stage. Perform broad unifying strokes over the back and arms. Thoracic work is complete. Let's move to the neck and shoulder area. Palpating the zone, I can feel the upper ROM. We found a trigger point that is currently very tight. Apply deep pressure. There is a second highly effective release method. Anchor the point and shift your fingers slightly, just a few millimeters, without sliding. Pin the trigger and smoothly shift it along the muscle fiber. This is the most effective way to release deep-seated trigger points. The muscle stretches, my fingers sink deeper as it begins to relax. Always choose the most comfortable working position. Standing on one side allowed me to clearly feel the muscle tension. If a position becomes awkward, move to a better angle. I've stripped the muscle up to its attachment at the medial border of the scapula. Anchor your hands here and maintain pressure on the attachment. Now simply wait for the muscle to yield and relax. As tissues relax, the client's pain will gradually fade. Chronic spasms can cause fibers to thicken and fuse together. This is fibrosis. Note that massage cannot fully remove it. We can improve tissue health and ease tension, but fibrotic changes are permanent. The fibers have fused into a new physical form that won't respond to kneading. You can already see changes in the muscle volume. Initially, the upper corner of the scapula was bulky and protruding. Now the contour has leveled, the spasm has significantly decreased. Notice how the upper edge of the scapula now sits flush with the back. Deep tissue work achieves this excellent visual realignment. Results vary based on individual tissue characteristics. However, the positive effect of deep work is visible after the first session. After trigger work, always finish with a soothing stroke. After long local work, cover the back with a towel to keep it warm. Add intensive friction if other areas start to cool down. Maintaining the client's body temperature is vital throughout the session. Having finished the interscapular zone, we move to the scapula and arm. While working one limb, the other side of the back can rest and recover. Increased blood flow after deep work is key to muscle recovery. Standing at the head, perform glides from the spine toward the shoulder joint. I'm focusing on the scapula and transitioning to the trapezius. After 5 to 6 glides, move to a position opposite the corner of the scapula. Now perform similar glides downward from the shoulder. One glide follows the lat toward the low back. Apply deep pressure here. My goal: compress the lat from its shoulder attachment using my palm. Repeat 5 to 6 times, then work along the midline of the scapula. Perform straight glides 5 to 6 reps and move to the upper scapular edge. I use one part of my palm for the scapula and the other for the trap. This compound move works multiple adjacent muscle groups at once. After glides, we begin the scapular mobilization technique. Secure the scapula from above and below and use your body weight to move it. Don't use just arm strength. Lock your hands and move with your whole body. Your arms simply follow the impulse from your core. Now move back to the side of the table. Find a stable stance to work the upper trapezius and shoulder. Starting from the upper scapula, glide down the trap toward the shoulder. The second hand follows, creating a continuous flow of pressure. Use your body weight to create the necessary tissue tension. Hook the shoulder and use your mass to pull it back smoothly. If one hand is difficult, stack your hands for added power. Lean your center of gravity back, following the motion with your entire body. This technique effectively releases overall tension in the upper traps. It's not for pinpoint work, but it quickly lowers hypertonus in the whole muscle. Compress the deltoids deeply to prepare for specific work. For a detailed deltoid massage, move the client's arm slightly outward. This position opens the shoulder for better access. Use a beak-like kneading grip to engage the muscle mass. The clavicle is here. Grip the deltoid heads firmly. Compress the tissue and perform glides with your hands opposite each other. Option 2. Reposition the arm so the shoulder is slightly elevated. This frees up space. Use a one-handed kneading grip. Use 4 fingers for intensive circular rotations across the deltoid. Remember, don't just use fingers, include your shoulder and body weight. Finger strength is for the final grip. The rotation comes from your core. If the deltoid is large, follow up with forearm stripping. Secure the arm with one hand and glide with the other forearm. Use the fleshy part of the forearm, avoid the triceps for now. The current goal is deep targeted work on the deltoid. Rotate the arm to open the deltoid, which is usually tucked away. Once accessible, perform a series of short forearm glides. Finish with a soothing stroke for the skin receptors. Now focus on where the scapular muscles attach to the humerus. The lats teres major and minor converge. Here it's a high-tension zone. Work the teres muscles prepped earlier with straight glides. Soft fist glides are very effective in this area. Mind the anatomy. The scapular spine divides the bone, avoid pressing on it. Direct fist pressure on the bone is extremely painful. It's useless and can irritate the skin. Stay on the soft tissues. Work with the fist only on the muscles above or below the bone. The scapula has enough muscle mass for safe deep fist work. Forearm glides are also effective to secure the arm and glide. In athletes, these muscles can feel like stone. Knead with a fist or forearm before moving to detailed thumb work. This allows your thumbs to penetrate much deeper into the fibers. Since the muscle can shift, secure it firmly with your fingers first. Once anchored, perform a very smooth, deep glide. Follow the muscle line compress and hold for several seconds. This achieves the ischemic compression effect. If you lack hand strength, use the lever technique. Place your thumb, stack your other palm, and press with your full weight. This achieves maximum depth without tiring your hands. Release slowly and finish with light fingertip vibration. Vibration eases tension after deep work, then smooth out the area. Moving to the next area, many people hold significant tension here. I'll show the technique for accessing the latissimus dorsi. With the arm moved aside, you have excellent access to the lat. In this position, the lat is often found to be spasmed or tight. The client can feel this tension even during simple arm movements. Start from the humerus attachment and move toward the forearm. Apply pressure and glide along the outer edge of this muscle. Use an angled grip between your thumb and index finger. Focus on deep compression anchor and glide. Grip the client's arm and gently pull it upward during the glide for better effect. This method performs two critical actions at once. First, deep tissue compression. Second, functional stretching of the lat. Switch hands and adjust your stance for better leverage if needed. I'm switching to perform the glide with the heel of my second palm. One hand pulls the shoulder while the other glides using body weight. Important: avoid the axilla, armpit. Never apply pressure there. Move strictly along the outer muscle edge to avoid lymph nodes. Finish with a soothing stroke and a final control compression. If deeper work is required, use your forearm. Grasp the client's arm with your distal hand to control tension. Place your forearm on the lat attachment and apply firm pressure. Gently move the arm forward to stretch the muscle fibers. Glide your forearm down the torso, working deep into the target zone. Keep the pressure focused on the muscle belly. If you shift too far, you'll hit the ribs. This is painful and incorrect. Goal-targeted pressure on the latissimus dorsi without rib cage irritation. After the shoulder, move to the triceps, biceps, and forearm. Apply a bit more oil to the limb if necessary. We previously only oiled the top-facing parts of the arm. The outer and lateral sides may be dry, which hinders the glide. One pump of oil is enough for the rest of the arm. Apply oil with smooth motions to begin friction. Distribute the oil evenly across the limb. Thoroughly prep the entire working surface. Starting triceps work, we can begin with classic palm glides. Note: ensure the client's arm is in a comfortable position. If the biceps press against the table edge, triceps pressure will be painful. In this position, the table compresses the biceps from below. Avoid this. Move the arm slightly to ensure it rests flat on the table. With the arm supported, you can safely use deep pressure. Perform smooth glides without causing discomfort in the antagonists. Glide along the central line of the triceps. Then shift the vector to the lateral side of the arm. This is the lateral aspect of the humerus in anatomical position. Perform deep triceps compressions and glide toward the shoulder joint. Finish at the deltoids, repeating 5 to 8 times. Return to the midline, then move toward the medial inner arm. The inner arm requires very light pressure. The skin here is sensitive. Secure the arm with one hand and perform delicate glides with the other. Reminder: be gentle near the elbow crease. Follow up with a soothing stroke over the entire limb. This prepares the triceps for more detailed, deep kneading. If palm strength isn't enough, use your forearm. This is ideal for athletic clients with high muscle volume. Anchor the client's arm for stability with your distal hand. Glide with the other forearm along the midline to the shoulder. Glide smoothly and deeply. This is highly effective for this zone. This targets deep layers without overstraining your fingers. Now for detailed kneading, use a beak grip and shift. Roll the muscle belly under your fingers to work the tissue. This deep, soft kneading fully releases triceps tension. If you find knots, target them with your fingers. Use short, deep thumb glides to eliminate spasms. There's a clear trigger point here on the lateral head of the triceps. This spasmed area needs extra focus and localized pressure. Anchor the muscle before applying force to prevent slipping. Compress, pause, and glide along the fibers. Avoid jerky slips. Follow up with soothing strokes and tapotement. Vibration eases the muscle. Now for the biceps. Raise the arm and perform circular rotations under the biceps. Follow up with long unifying glides along the inner arm. Next, work the forearm with long glides from wrist to elbow. Transition smoothly into a general arm stroke. Now for the lateral outer forearm. Begin kneading with 4 fingers using deep circular rotations. We're working the lateral side where muscles are often overworked. Resting the client's arm on your hand allows better pressure control. For severe tension, place the arm on the table and use fist work. Important: avoid working on the elbow bones. Work only on the muscle belly. Lower your stance to keep the client's arm stable. Ensure the elbow doesn't collapse. Avoid awkward joint angles. Forearm glides are also very effective here. Follow with a soothing stroke and turn the hand palm up. Position it comfortably and begin the medial inner forearm work. Start with preparatory glides along the surface. Secure the wrist and perform deep glides toward the elbow crease. Next, use soft fists. Use alternating hands if the arm is stable. If it moves, continue securing the wrist with one hand. This technique maintains muscle control and pressure. You can repeat deep forearm glides in this zone if needed. Reminder to never apply forceful pressure directly to the elbow joint. Smooth the forearm and move to the wrist and hand. Use thumbs for deep midline compressions. If the arm slides, stand closer to the head for better stability. Directing the force toward the fingers keeps the limb from shifting. This creates comfortable tension on the table surface. Perform final glides toward the fingertips. Note only glide toward the hand if there is no visible edema swelling. If swelling is present, all glides must move toward the heart. Without lymphatic issues, you can work in both directions. Thoroughly work the wrist area, addressing each ligament. Finish with a general stroke and proceed to soft traction. Grip just below the joint and apply smooth, controlled traction. Stretch the limb an extra 3 to 5 millimeters in a relaxed state. Hold for 15 seconds to relieve joint pressure. Release slowly and return the arm to its original position. Perform a final soothing stroke toward the upper back. Repeat long strokes on both arms, finishing with a full back glide. You can also use soft fists on the upper traps near the C7 vertebra. Return to this zone for deep work on the traps and neck. I prep this area intermittently throughout the session. This keeps the tissues warm before the main deep tissue work. Apply soft fists and perform circular rotations alternately. Lean your way into each rotation for necessary depth. Work both sides together, finishing with a soothing stroke up the neck. Now move to the other scapula and begin glides. Repeat the sequence of techniques used on the first shoulder blade. Stand opposite the shoulder joint and glide firmly over the lat. Direct pressure toward the low back along the lateral surface. Return to the center of the scapula for detailed work. Use your full palm for a uniform deep glide. Transition smoothly to the upper trapezius. One hand works the scapula, the other focuses on the trap edge. Shift your position to change the angle of pressure. Perform deep traction glides from the upper trap to the shoulder. Proper tissue tension is critical here. Maximize your body weight for this technique. Anchor firmly and lean back to create powerful traction. Glide until you reach the deltoid insertion, then return. Finish with a soothing stroke and move the arm aside for shoulder work. Focus on the muscle attachments around the scapula. Start with soft fists to prep the deeper layers. Then switch to pinpoint pressure using your thumb pads. I can feel spasmed muscle fibers under my thumbs. Anchor the limb and apply local pressure to the trigger point. Pause briefly, then glide smoothly along the fibers. The muscles are short here and can easily snap away. Work very slowly to maintain constant steady pressure. If your thumbs tire, use your forearm for reinforced pressure. Now let's give extra attention to the latissimus dorsi. Use a combined stretch and glide technique. Pull one arm while pushing the client's torso away with the other. This creates intense pressure and high-quality stretching of the lat. Guide it forward to fully open the muscle fibers. Use the heel of your palm for maximum pressure. Shift your whole body while keeping the shoulder locked. The drive comes from your legs, ensuring a powerful, stable stroke. This allows smaller therapists to achieve deep results. It's much more ergonomic than using only arm strength. Switch your hand position as needed for comfort and leverage. Finish with a soothing stroke. Reposition the arm and move to the triceps. Add more oil to the arm for a smooth glide. Spread the oil evenly over the upper arm and forearm. Use your forearm if the tissues are too dense for fist work. Forearm work provides deeper, more targeted coverage. Next, use the beak grip work from different positions. Kneading from the head of the table is ideal for gripping the triceps. You can also work from the side without losing quality. Both positions are equally effective. Try both to see which works best for your ergonomics. After thorough kneading, move to thumb glides. Thumb glides are most effective from the side of the table. Avoid an awkward pressure vector by standing correctly. Glide up from the elbow toward the shoulder. Soothing stroke, then gently lift the arm to work the biceps. After the upper arm, shift focus to the forearm. Perform effective traction glides along the forearm. Grip firmly, compress, and pull smoothly toward you. Rest the arm on the table, anchor it with one hand to prevent sliding. Hold the limb steady while the other hand glides. To perform simultaneous alternating fist glides, change your position to the other side of the client's arm. This angle lets you glide toward the wrist with maximum stability. This stance ensures the best ergonomics and pressure vector. Moving to thumb work if your hands are tired. Place your thumb, reinforce it, and use body weight. Finish with a smooth stroke over the forearm. Now deeply knead the wrist area. Move to the end of the table for a unifying arm stroke. Grip the hand just below the wrist for soft traction. Apply a gentle pull and hold for 10 to 15 seconds. Release slowly and follow with a soothing stroke. Return to the head of the table for a broad full-back stroke. The last step is the upper traps, C7, and the neck. Then the client turns over for work on the chest and neck. We finish with a final neck and scalp massage. Soft fist glides are the easiest way to work the traps. Glide along the trap, then adjust your fingers for the neck. Important work only the posterior lateral neck muscles. Avoid the anterior neck due to carotid arteries and nerves. Work only the neck extensors up to the hairline. Focus on the muscle attachments at the base of the skull. Perform deep, smooth movements covering every centimeter. You can also use a soft fist along the upper trapezius. Glide toward the shoulder and back, moving onto the neck. Apply deep glides while gently stretching the neck structures. Soothing stroke the muscles are ready for detailed thumb work. Begin alternating glides following the anatomy. The trapezius is superficial focus on the deeper muscles beneath it. These deep layers often spasm, requiring intensive glides. You can work alternately, though deep volume requires focus. Palpate the entire zone first to locate trigger points. Goal: find all adhesions. I found a very painful trigger point. I have enough strength here to work this knot with my fingers. However, many therapists may need extra leverage. Don't overstrain once you find the point. Anchor your thumb and stack your other palm on top to reinforce pressure. This reinforced technique achieves deep compression with minimal effort. Work qualitatively without fatigue throughout the day. Alternatively, simultaneous two-thumb pressure is often easier. Hold the point for maximum effect at a short lateral shift. Shifting while compressing is much more effective for releasing blocks. Having worked one line, smoothly shift along the muscle belly. Goal: release the entire segment. Most clients are severely spasmed here. This is exactly why people seek massage. Work this area thoroughly. Releasing the tissue improves nerve communication with the brain. Receptors fire faster and circulation improves. Everything is inner. Chronic contraction is a serious issue that deep tissue massage resolves. Stretch and release this area mindfully. Work through the trapezius meticulously, centimeter by centimeter. I'm currently using simultaneous two-thumb glides. I found a tender point that requires special attention. Deep triggers may not fully release in one session. Don't force it. If a point doesn't release after 30 seconds, move on. Overworking one spot can cause localized inflammation. A course of 3 to 5 sessions is best to resolve spasms safely. After the deep work, glide down with a soothing stroke. Perform a final smoothing stroke. Soothe the traps locally, then finish with broad unifying strokes. Note, once the back and arms are done, focus on the neck. Drape the client's back to maintain warmth while working the neck. Stay focused on the neck and head now. Use deep compressions followed by gentle finishing strokes. Finish one side, then move to the other. Repeat. Move from the spine toward the scapular corner. Compress. Reach the attachments and pause. Allow the muscles to stretch and relax under your steady pressure. If you lack hand strength, reinforce with your other palm. This transfers your body weight efficiently, then shift laterally. Shift about 2 to 3 centimeters toward the scapula. Now move on to the upper trapezius. Work the junction of the neck and shoulder, the topmost trap edge. If the muscles are rigid, use a fist technique. Watch this lever brace your working elbow against your own hip. This transfers your body weight directly through the elbow to the fist. Lean your weight onto the client's trap instead of using shoulder strength. This creates a powerful, deep, and stable fist compression. Brace the elbow against your hip and anchor your fist. Compress and perform a very slow, smooth lateral shift. This is perfect for therapists who find dense muscles difficult. This leverage works even the largest clients' traps with ease. Finish with a soothing stroke. The muscle softens under your palm. Next, anchor your thumb using other fingers on the shoulder for stability. Shift your weight into the tissue, alternatively work with thumbs pointed down. Place them at the neck base and glide toward the shoulder joint. Anchor exactly in the angle between neck and shoulder compress. Then smoothly shift the pressure toward. Keep your hands locked. The motion comes from a pivot of your core. Smooth the area and prepare for the cervical neck work. On the neck, interlock your thumbs and perform circular rotations. Make 2 to 3 passes up the back of the neck toward the skull. Reach the hairline and work the attachments on the occipital bone. Start at the base, reach the occiput, rotate, and return. Alternative work only with your thumb pads. Perform deep glides, thoroughly kneading each muscle bundle. Another option, interlock your fingers and use rhythmic squeezing. You can simply squeeze or add gentle circular rotations. Try a beak grip, anchor the muscle laterally, and work in one spot. Rule: avoid the anterior neck where the carotid arteries are. Work only the neck extensors. Grip the muscle, squeeze, and knead. Smooth the neck and cover the client to maintain warmth. Now for the scalp massage, starting with the muscle attachments at the base of the skull. Most people hold significant tension in this area. Anchor your fingers on the scalp, ensure they do not slide over the skin. The scalp should move over the skull, do not just slide your fingers through the hair. Feel for the subtle areas where the muscles attach to the bone. After 5 to 10 strokes, shift up 1 centimeter and repeat. Apply firm pressure and perform short circular mobilizations. This is key. Simply sliding over the hair provides no therapeutic benefit. Work the crown if using fingers is off. Brace your other fingers on the face cradle for better stability. Thoroughly massage the entire scalp area. To finish this stage, use this specific move. Perform gentle rhythmic palm rotations on both sides of the head. This is deeply relaxing and highly effective for calming the client. If the scalp is extremely tight, focus on deep thumb work. Brace your hands on the cradle and anchor your thumbs on the attachments. Perform targeted circular rotations at the points of maximum tension. If you find a severe spasm at an attachment, apply sustained pressure. This hold releases deep tendon tension, then follow with soft kneading. Work across the entire occipital area systematically, removing all blocks. You can also use a stretching technique for high overall tissue tone. Anchor your palms on the occiput, apply a slight stretch, and hold. Wait for the suboccipital muscles to yield and release under your hands. I can feel the tissues softening and releasing now. This concludes the prone portion of the back, neck, and scalp massage. Finish with light fingertip tapping to potent over the head. This helps the client wake up slowly, as scalp work often induces a deep state of sleep. Now please have the client turn over to continue with the décolleté and neck.